Here.
Val, Joliet, and Luce.
Present.
You have the floor.
Thank you. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is approving the minutes from July 9th, 2024. I have a motion by Commissioner Taylor. I have support from Commissioner Powell. All in favor say aye.
Aye.
Opposed? All right, the minutes are approved. Next is approving our agenda. I have a motion by Commissioner Taylor and support from Commissioner Erickson Galt. All in favor say aye.
Aye.
Opposed? All right, our agenda is approved. We move to our first public comment. Is there anyone from the public wishing to comment for items on the agenda? All right, seeing none, our first public comment is closed. We move to our presentation entitled Challenges Adoptive Parents Face in Michigan. And we have our presenter, Sherry Ross, here to talk about this item. So Sherry, I would invite you to the front of the table and welcome. So there were some questions in the past about the experiences adoptive parents face with children in their home and sometimes behavior problems, which is how we arrived at inviting Sherry to talk about more about what DHHS offers and experiences and has. Thank you.
I'm Cherie Ross, and I happen to be an attorney, and I happen to have been a foster parent, and I happen to be an adoptive parent, 3 biological children and 5 adopted children, 6 daughters and 2 sons. I'm not here in a formal capacity on behalf of the Michigan Department of Health and Human Services, nor the board that I sit on, or any other groups. I just wanted to make that clear, that I indicated that I would come with the opportunity to speak on my own personal experiences. Having said that, I'd like to start by saying that once I began to serve on the Michigan Department of Social Services, Health and Human Services Board as an appointed, in an appointed capacity by the county commissioners here, it gave me the opportunity to see what is going on, not just in our local county, but also statewide. And I have to say that I am very proud of what you all are doing in Oakland County. As our county commissioners, you guys are meeting the needs of our constituents. Our constituents get to write us letters and tell us whatever problems that they have. As a board member, we often get them. I should say we don't often get them, but when we do, we have had great success in making sure that our county directors and whoever needs to make a difference and impact in those cases. Excuse me. So I read the article, and some of the things that I think that were not in the article are things that I think are important. I'd like to say that I'm very proud of the department and the various things that it has done up to date. We're not perfect. There's always going to be some things that need to be worked on, tweaked, adjusted. But I believe that on the statewide level with our current Child Welfare Director, Demetrius Stallings, and our local county director, Tom Shire, we have seen a significant decrease, if you will, in kids coming into care in Oakland County. And we have also seen our preventive services make an impact to our children. So what I wanted to do was talk about, real briefly, just to give you a little background of how I got involved. I came into the knowledge, if you will, of the foster care system as right out of law school. I started working for Children's Charter of the Courts of Michigan, which happens to be organization that works on behalf of all probate courts in the state of Michigan. There's 110 counties, and so they worked, to coordinate efforts, if you will, with all of our probate courts, and also define and design programs, if you will, that would assist our child welfare system. And that's where I got to learn about the Court-Appointed Special Advocates Program, which some of you are aware of, that assists children, bring voices to children in our court systems. And I was one of the people in the state of Michigan that had that responsibility when it started to get it up and moving in our state. I've been on the Foster Care Review Board, if any of you are familiar with that, on both the statewide board and on the local Wayne County board. I've served on the Juvenile Justice Commission. I have worked in so many hours with the Chief Justice Maura Corrigan at the time with the department, and in so many other arenas. I also trained in the Child Welfare Institute for what was in the Department of Social Services. So bring a wide range of experience, but would not have seen the same things that I know if I were not a foster parent or an adoptive parent. Having said that, the things that bother me with the system, the old things in 1989 when I got involved, when I fostered the first set of children, a lot of those issues have been resolved. However, there's some things from even that point that have not. So from a foster parent and an adoptive parent mindset, the article talked about parenting classes and resources and things of that nature. I want to go on record saying, the parenting classes were fun, innovative, learning experiences that tended to be different depending on what agency you got the training from. And so if you were a person who adopted children who came through different agencies, you were on different agencies' spectrums with respect to what their requirements were that you needed to meet for that agency. And so to me, that was kind of interesting that one agency would be different from another agency in their trainings and expectations, even though they were contracted through the Department of Health and Human Services. And the thing that's important about that is that they make a decision. Those agency people, if you tick them off or they don't like you or you said something during that training that they don't like, they will not write a recommendation for you to go forward either in foster care or in adoptions. So I think people who are unknowing to the system, who don't know that, might make mistakes, and they probably did not end up being foster parents and probably did not wind up being foster parents unless they went to another agency. But the thing also that from a perspective of a foster parent and in an adoptive parent, there's fear. All the parenting classes and things are based on the would-be children that you would be bringing into your home. And they give you a little bit of information of what you might be able to expect with respect to certain children, but they have no interest, no conversation whatsoever what happens to your biological children if you have them in the home. There's no information, no concern about them. In fact, the parenting classes and everything dynamically involved with that is all stressed on the children that you're bringing into your home. Everybody brings gives them the foster kids gifts. They, give them bikes, they give them all these things, but they do not do that for the children in the home. But they tell you that you need to make sure as a foster parent and as an adoptive parent that your family members, friends, when they're giving your biological children gifts, that they also give to the foster kids so that the foster kids don't feel left out. And this is the training, this is the concept. The other thing that brings fear to a foster parent and a would-be adoptive parent is that, to me, there's amnesia in the system. And the systems are disconnected and they're not talking. And I'll kind of tell you about the amnesia. The amnesia part is, when they gave you these children and they said, you know, I had fetal alcohol syndrome, I had one with post-reactive attachment disorder, one with post-traumatic stress disorder, and a whole bunch of other things that the therapists and clinicians couldn't identify at the time because they were so young. And some things you don't know until the kids grow up and they manifest, okay? So with that, with those various different diagnoses, I could not find therapists and people treatment plans where people agreed on the method of therapy, you know. So as this agency referred you over here and this agency referred you over here, it wasn't until we had the children, possibly maybe 5 or 6 years, that then we had a psychologist. Well, they had evaluations as early as age 2 and 3, psychological evals. But it wasn't until we went to this, we said, okay, we're not gonna part and parcel, you know, we're gonna spend our own monies out of our own pockets to send these children to a different therapist, because that quite naturally, when kids have Medicaid, you find doctors that don't accept it, you find dentists that don't accept it, and you find therapists that don't accept it. And so with our Blue Cross Blue Shield, you know, they will pay for certain things, but then there's that copay, and then if you need anything above that, it may or may not be covered. But what I didn't learn was we were told in the whole foster care process that these children have to have group therapy and individual therapy. And quite naturally, you do what they're telling you because you want to, you know, continue to foster and you want to continue to adopt. I didn't find out, or our family didn't find out till some 5, 6 years in this process, and as the kids grew older, that now we somehow had hurt the children by doing group therapy together and the individual. And when I was told that, I was like, what? Well, one child in this sibling group had not had the same experience that the other children had. He was much younger than his sisters at the time. And so he learned things in group therapy that had happened to them that he had no knowledge of, which now created a whole different spectrum of issues for him that we were unaware of. And that it caused some then acting out behaviors and some other things. The amnesia comes in when and the fear is when you bring these children to a school environment and in a school setting, right? And as a adoptive parent, I want the best for my children. So I'm going to be transparent. I'm going to say, hey, you know, these kids have had these evaluations. These are things that we have observed over the years. And we're trying to work in cohort with you, in concert with you, so that you understand our children, you understand us, you know where we're speaking from. And I even shared the psychological eval, because in the Bloomfield Hill School District, they do have a school psychologist, and they, you know, all these different things. So when we came to the Bloomfield Hill School District in Oakland County, to me, that was the nightmare of the nightmare. As I am a practicing attorney in this community, you know, you're like, you know, no one told me that if an issue comes up with your adoptive children or your foster children, these children were adopted by them, that they can come and take your biological children.
What?
So that's not part of the parenting classes. That's not part of anybody's training.
So that's if you're giving up your adoptive child.
No.
No?
When you take foster children into your home, if there is a CPS complaint made about the foster kids, they will come and get your kids too.
So they take them all.
They take all of them. They take all of them. No one tells you this. So when you become an adoptive parent as well, that's the same thing. So your own biological children are at risk once you become a part of the foster care and the adoption system. So when we came to Bloomfield Hills, my providing that psychological report for one of my children, when he came to live with us, he turned 2 the day after, and his other 2 siblings were with us as well. The environment that he was taken from, he was eating, it was cited in his evaluations and social work reports that he was eating newspaper for food. he was eating bugs, spiders, and it was very detailed, and that he was eating out of the trash can. Well, this was part of his confidential psychological eval report that I gave to the school and was assured that it's not a part of the school's social record file and that no teachers have access to it. It was just going to be something clinical within the school. So when I came to Bloomfield Hills District, the first thing was you don't expect that you're gonna encounter discrimination. Discrimination not just based on color, but based on the fact that there is a view in Oakland County that we encountered that they don't want these kind of kids in their schools, and they don't want foster kids. It's a bad thing to be a foster kid, and it's a bad thing to be an adoptive kid in the school district. And so immediately, we started getting contacted from teachers who made a CPS report because they said education neglect. Because our children, we had them evaluated because they felt our children should be in special ed. Specifically, what they said to my husband and I was, they're gonna bring down our grades, our testing scores in the district. So we don't want your kids to take the normal testing test. We want them to take alternative tests so that they don't bring down our grades. My response to them was, you're supposed to be one of the best schools in the United States and in the state of Michigan. Educate them. So because of the CPS report for education neglect, I said, okay, let's, because we've been real good with having our kids evaluated over the years, and I guess what's some more evaluations gonna do, right? So we decided to let them go ahead and get the IEPs and all this other kind of stuff. Well, it came back, our kids didn't qualify. Then they had a dilemma about that. So the next thing I know, I get a phone call from a Mr. McKenzie. I never met him, don't know who he is. He called me in the late evening. I grabbed my cell phone, didn't recognize it. He goes, I am calling you on behalf of all of the first grade parents and the kindergarten parents. Really? Okay, what do you want? We do not want your child sitting next to our child on the school bus or having anything to do with our children on the school bus. Well, why is that? Well, we're just letting you know. So the next thing I know, there's another CPS report. There's a CPS report, and I come home, there's this card on my door, and as an attorney, my heart is shrinking. Oh, Lord, I'm gonna lose my license. What the heck is going on now? So I get this card, I call the lady up, and they come out to our house, and they said, we got a report that your child was eating out of the garbage can, that your child was eating bugs, and he's not getting food. Now that was in his psychological eval that came from the birth parents when we got him in foster care and then ultimately adopted him. Someone at the school went into the confidential social file, shared it with the teachers, shared it with the parents, and we found out it was a social worker at the school. We found out that and we made a complaint, and then they told us that they fired her. I don't know if they just moved her to another school or not, which is probably what they did. But nothing in our system could prepare you for anything like that, Nothing can prepare you for the discrimination that took place from then and then and then and then. And that, so my kids who were overcoming the systemic things that they had encountered from early birth, the trauma and all of these other things, now were, my daughter teacher in second grade hit her. We had to deal with that. We're down there talking to a second grade teacher about hitting a second grader for whatever the reason. So we spent a lot of time and effort going back and forth to the school, talking to the superintendent, going back and forth. We should have sued him, but we didn't. Because I said, maybe this is a learning opportunity. Maybe, there's something, because these kids do have parents who are resourced in a sense of being able to access information and to do things about it. But that amnesia comes in again because after all that, finally, after the third CPS report, the person that came out, she says, look, I'm just gonna put something on here because the reports were coming from the school. They were coming from the school because they couldn't make this mama label her kids what they wanted her to label her kids or to remove her kids from certain programs. Now, as an adoptive parent, resources that were not available to my children, you know, the Medicaid program in that whole scheme of things. So when you're going to a school like Bloomfield Hills, these kids are resourced, right? They don't have Medicaid eyeglasses. Medicaid only gives Medicaid eyeglasses, and everybody has ever seen Medicaid glasses know what Medicaid glasses look like. Anybody here that don't know what they look like? They don't even look, I mean, they have this whole plastic appearance of a bifocal thing, and you know, that's the best you can get. So of course, we did always have to expend resources to do better than what was being provided. There were no resources to send them prior to adoption. We took our kids on cruises, biological. We had them in all kind of dance classes, you know, you name it, all kinds of structured programs and camps. When it came to now the adoptive children, you know, there was no resources. We could call the Michigan Adoption Subsidy Department. There were no programs to pay for a $900 camp when you got 3 adoptive children, so that's times 3, or any other things that those kids. And so how do you think those kids feel when they see other kids being able to do these things, swim lessons and all these things, and we can't do them, and automatically they feel, because see, they don't really love us. These people, there's nothing for us. So the other part about amnesia for me was, you know, as an attorney, I then get a letter from the Oakland County Prosecuting Attorney's Office bringing me to court for failure to pay child support for the adoptive kids. At first I thought it was a joke.
I'm going to interrupt you
Okay.
here. Thank you. It's interesting, but we have limited amount
I
of time.
realize that.
So one of our commissioners wanted to understand the challenges and how we can make a difference going forward. So this might be a longer conversation.
And so some of the challenges is the things that I identified, but there's a disconnect between the child welfare system. There needs to be a coordinated effort, if you will, between mental health, education, and social services. Those 3 components need to come together so that they're all speaking the same language, so that you can begin to make a difference in the children's lives, and it takes off the stress on the adoptive parents and so forth. So that was a big thing. Resources has not changed. That's still an issue. But the question is as I think Commissioner Gershman has said, you know, finding the dollars. You know, finding the money to put into those plugs in those areas where resources are needed, so that the foster parents and adoptive parents don't have to liquidate their whole life savings trying to give our other children the same experience that we would our biological children. And so I can send you like a follow-up of some of the things, but you know, child support, you know, they get the wrong people. I mean, just so many different things, as that article talked about, mental health things or things that can stress out an adoptive parent. Those are things that are happening when your adoptive child gets involved in the juvenile justice system. They want you, the adoptive parent, to pay for their housing in Children's Village and reimburse the county for behaviors and things that we already know that these children were probably going to present as they got older. So these are all things that you can't plan for, nobody can train you for, and they just come up when they come up.
Thank you. And I know the state and DHHS and our local community mental health collaborate with an SED waiver program, the severely emotionally disturbed waiver, that assists kids with these difficulties to provide home-based services and wraparound services, camps and more. So some things have changed throughout the years and are getting better, but we can, Commissioner Gershenson, maybe you wanna arrange a specific meeting to see how the county can be involved.
And I'll give you a more detailed list.
Sure.
But those are just my encounters. There's other people may be experiencing a whole bunch of other stuff.
We appreciate you coming in. We have not had any sort of reporting like this, and just doing a yearly and annual report doesn't give us any of the flavor of what's really going on. So we'll talk afterwards and
Yeah, I got ways to just knowledge.
Okay, Commissioner Powell?
So, the two leader names, can you give us those again? You said the two new leaders that's been appointed.
So
Tom Shire?
Demetrius Stallings is the statewide child welfare director. The local county director is Tom Shire. Now, they are not newly appointed. The new cash assistance director that has just newly come in within less than the last 6 months is Ahmad Sabah. He's the new Oakland County director. And on the statewide cash assistance, it's Dwayne Haywood, who is championing that role on a statewide level.
Okay, and then you said the three components that needed to come together was mental health, social services, and what else?
Education. And I'm sure that someone else in your experience, or as you hear people, there may be another component. Because in Michigan, with the educational system, some school districts don't want the child to be in their school district if you don't live there, but even if they're taken from that district. So that's just a whole bunch of stuff that it needs to be worked on.
And one thing, I was gonna make a comment. So a few years back, when I worked under Tim Gramo as a state rep, we had a meeting with foster care and adoptive parents. And it was just too much to hear all of the stuff that they would go through to try to take care of these kids. And then that state system put all that, what she talking about, I mean, it had to be we met with about 20 parents. So all I'm saying is if that's something we wanna kinda just start listening and tackling, that could be a committee, I don't know. But it is a conversation that I think needs to be had to understand that. Because the only thing out of the comments that you stated in your report that it doesn't shock me, but I think it's crazy that you live in Bloomfield Township, and I think they do that to parents who live in areas that got money, but at the same time, you're right, they should dwindle down some of the resources to kind of help with the adoptive, because you didn't bank your budget off of 7, 8 kids. You banked it off the 3 you had, you know what I mean? And now you're trying to step up, do a favor for the state, help them with these kids, and then they put all these other burdens on you. And it's really only because of your zip code, because a parent like you in Pontiac, they would have flooded them with all the service.
Oh, really?
Oh, yeah, it's by your city. And if a parent in Pontiac who adopted some kids needed this, and their income ain't Bloomfield Hills, they will get it. So that's something at the state that I think that they need to look at all of that, because that is unfair, because them kids, be it if they went to Bloomfield or Pontiac, should get the same resources, be it whatever the income is, because they're coming into a home that you didn't budget for that. You and your husband ain't planned for that. And I think that is a disgrace for the state to even handle stuff like that. Thank you.
All right, thank you. Thank you,
Thank you.
Cherie, for coming
Thank you.
and talking to us.
And I will let the board know quarterly you would like to see us.
okay. And if you have a
And we
card,
can put that
Sheree.
request in, Marcia.
Yeah.
Yeah, to Dr. Dudley and the team.
Yeah, because the other thing too was we had hoped that we would have a liaison from your committee.
Actually, that was supposed to happen.
Yeah.
We never got appointed. We'll talk about it. Thank you.
Okay.
Yeah, because I inquired about it.
Okay.
Thanks, Sheree.
Now that
Thank
we
you.
brought that up. Now that you brought that up.
All right, thank you. So on our agenda during the last 30 minutes when we started, we have a change. So item 11C, acceptance from the State Housing Development Authority.
No, this is
No.
the older one. You have to see now, if you
Oh,
remember.
11C, sorry.
Yeah, you You have it correct.
It's an application to evaluate existing operations and business practices is going to be removed from the agenda. Thank you. So we moved to communications. We have 12 items under communications. 8 are grant applications, 2 are amendments, and 2 are reports. Would anybody like to make a motion to approve communications? We have a motion by Commissioner Powell, support from Commissioner Taylor. All in favor say aye.
Aye.
Opposed? All right, communications are approved. We move to our Sheriff's Office recommendations. There are 2 items. The first is an amendment to the MCO's Public Safety Academy Assistance Program. And the second is an application to Enbridge for the 2024 Safe Community First Responder Program. I have a motion by Commissioner Kinzo. I have support from Commissioner Joliet. Welcome. Thank you.
Good morning. So the first item is an amendment to the MCO's Public Safety Assistance Program. This is our 4th application. And if you recall, this is new funding that we get for recruits that are in the academy. So this application is for 4 recruits. We get up to $24,000 each. And we've asked for a total of $96,000. So this funding is supposed to continue until funds are exhausted at the end of, or at September 30th, 2026. So I'm hoping that we'll be back before you again for another couple of applications and acceptances under this program.
Thank you.
The next item is an application to Enbridge for under the Safer Community or Safe Communities First Responder Program. This is for our search and rescue team, and it's for $172,950 for environmental equipment. So it will be a containment boom, vehicles, and the accessories to transport the equipment.
Thank you.
Answer any questions?
Are there questions regarding these 2 items? All right, would you prompt the vote, please?
Yes.
You have 7 yeas, 0 nays.
All right, both motions carry. Thank you very much.
Thank you for your support.
Our next 3 items are from the Health and Human Services recommendations. The first is an amendment to the Health Department agreement with the Michigan Department of Health and Human Services. The second is an acceptance from Eagle Rapid Methods and Microbial Source Tracking for Beaches program. And the third is another acceptance from the Housing Development for the 24-25 Housing Education Program. Who would like to make a motion? I have a motion by Commissioner Taylor, support from Commissioner Powell. And who do we have here?
Stacy.
So, thank you. Stacy, welcome.
Hey, Stacy.
Your
Can't hear you.
your mic doesn't work. Yeah. Try again. Can you say something, Stacy, now? No, sorry. We can see you but not hear you. Sometimes it's better, right?
Log out and log back in.
Yeah. So maybe Khadija, is Khadija presenter on another item? Maybe Khadija's microphone works? Hi, Khadija.
Hello, can you hear me okay?
Perfect, so let's
So
do.
no, it's not us.
Yeah.
Okay, good morning. Okay, so yes, we would like to request acceptance for the Michigan State Housing Development Authority Housing Education Program Grant Award in the amount of $17,855. And this will support homebuyer education, financial capability, foreclosure, and rental counseling services to Oakland County residents. The grant period is July 1st, 2024 through June 30th, 2025. The funding would be used towards salaries and fringe benefits to support the 3 FTEs who are providing housing counseling services within neighborhood and housing development.
Thank you. Any questions regarding this item? All right. Is Stacy ready? Nope. Khadijah, do you have another item to talk about?
No. You're muted now, Khadija. Khadija, you're muted.
I'm sorry, no, I do not have another item at this time.
Was that the only one that they both was on?
No,
Leanne,
Health Division has.
Yeah,
Oh, right, I'm sorry.
Yeah, I wish I could jump in on the other ones. I don't have information in front of me to
thank
kind
you.
of help support it, but maybe Stacy can get back on here. Thank you.
Or Leanne, is Leanne available?
No, this is White Space.
That's a-
No, I'm back.
Oh, yeah.
Office.
To the rescue.
Technology. So our first item is amendment number 3 to the fiscal year 24 local health department agreement from the Michigan Department of Health and Human Services. This amendment adds $680,000, $883 to the contract, bringing the total award to $14,993,233. In this amendment, there is an additional $382,000 to support critical public health infrastructure needs. And with that, we're requesting to create 2 full-time community health workers to help promote health initiatives to champion health equity and reduce disparities in the community. Also, we are adding $2,500 to the OSA recipient agreement through WIC. This funding will help implement international board certified lactation consulting services to WIC clients. Our next item is the grant acceptance for the 2024 through 2025 rapid testing and source tracking for beaches through the Michigan Department of Environmental and Great Lakes Energy. This year's grant amount is $70,302, and this funding continues Oakland County beaches, monitoring Oakland County beaches through December 31st of 2025. Okay, that's it.
Thank you.
Any questions?
Questions regarding the 2 items? Well, you did wonderfully. There are no questions. Thank you.
I'm like out of breath because I had to run.
All right, would you prompt the vote, please?
Is this just on A and B?
No, and C.
And C,
Oh, yeah,
okay, so
oh,
3
yeah,
items,
yeah.
okay.
We just switched the order.
Yes, I mean.
Joliet,
Yes.
you enjoy, yes. You have 7 yeas, 0 nays.
All right, the items carry, the motions are good. Thank you very much for working out the technology.
Getting my exercise in. Thank you.
Our next 3 items are, I'm sorry, our next 2 items are circuit court recommendations. The first is approval of the child care fund budget. Then the second is the application for the child parent legal representative. Who would like to make a motion? I have a motion by Commissioner Joliet, support from Commissioner Gershenson. So welcome.
Hi, how are you? So we'll start with the easy one, right?
Right, go ahead.
The CPLR grant. We were just here for acceptance of the FY24 grant. We're seeking your approval. Ramel has prepared a application for our FY25 CPLR grant, and we're seeking your approval to apply. One thing that I will note to you in the application, you'll see there's a line item in the budget that is kind of that we are going to be not accepting everything they want to give us. We already know how much they want to give us, but our budget, because it requires a match, will not afford everything they want to give us.
Oh, okay.
We do have to create our application for the full amount they want to give us, but we will immediately have an amendment once awarded that will give back some of that money, just so you know. We'd love to take all their money, but our budget doesn't support that match. So that is, if anybody had a question, I thought I would address that early on if you'd looked at the application.
Thank you.
Does anyone have questions about the CPLR grant?
Commissioner Powell.
So there's a grant where we can get more, but it requires us to match it?
Yes, they only match 25% of what we spend on services.
Oh,
This is,
got it,
this is,
okay.
this is the one that's allowing us to provide additional services. It reimburses us for part of the attorney fees. It will allow us to do training of our youth and family attorneys. It will allow us to do mentoring to try and attract more attorneys into going into juvenile law. And then it will also allow us to provide ancillary services. You know, if there's a barrier to permanency, maybe that an attorney can help with, then we can provide those services in addition to representation.
Of this amount, how much of that we're sending back?
Ramel?
Approximately 100,000.
Oh, wow. We had to match that.
We would have to match, we would have to match that, and we just, and honestly, we're so new in the FY '24.
Oh, okay,
Let's proceed, I'm okay with that. You know,
Okay.
we're not asking you to give us any additional money.
okay, cause I was
So,
gonna say.
no,
Cause you
not
said we
doing
would
that.
love to, and
Not
I'm
doing
like,
that.
wait
I
a
bet you
minute,
Brian
we
just
need
had
to
a
maybe
stroke over
assist.
We're not asking for any
This is
additional
news
money.
to fiscal prior to
Yeah, I was gonna
that.
say.
If we're just hearing about it right now, we would have loved to know about that during this budget process, Ms. Bujak.
Right.
But the good
If
thing
we
is, like
had
you said,
known-
it's
Been more
our
than
first
happy to know
time,
that
is this
before
an
the next
annual
meeting.
grant? Like, is it something that comes up annually that we apply for?
It is, yes,
Oh, okay,
and this will
so-
only be our second year applying for it. We
Okay,
did a
cool.
mid-year FY '24. It would have been something that had our attorney line item increased, like the request for our attorney line item been approved, we might have been able to do.
Are you talking about for FY '25?
Yeah.
Okay, no, we're talking about FY '24, so I don't wanna just have a
Yeah,
crossing
no,
over
it's
fiscal year.
fine, the commissioners is in the business of making sure our departments are resourceful,
Right.
okay? So at the end of the day, I was just making sure
And I
that is not a
appreciate that,
need
Commissioner
right now,
Hall.
so we have to go back to the drawing board to assist this department,
Yep.
that's all.
We are
So
not
just
asking
know,
for any
you have
additional
supportive
funds at this time.
commissioners who love to make sure our departments are resourceful and we're not wasting or having to send anything back. We wanna exhaust all grant funding that come in.
Yep,
That's all,
I
thank you.
agree.
Okay, we're on the same page, all right.
Does anyone have questions about the CPLR grant or what it covers?
You explained it before.
Okay. Do you wanna vote on that or are we voting them all together?
All three together.
Okay, so, yep, we pulled the SJI, there was an incomplete application, so we have asked to remove that. The childcare fund, so you've heard me say before that juvenile justice is changing, right? Things are happening, it's an exciting time to work here. The childcare fund is expanding this year, it's gonna cover additional positions. It's going to cover, you all know youth assistance, right? Youth assistance has kind of been our informal diversion program, the arm of the court for years. That has never received any funding from the childcare fund because it didn't meet the requirements. They didn't have a 20-to-1 child to worker ratio. They didn't have a weekly face-to-face ability with those kids, among a couple other things, but those have now been removed. And so our youth assistance workers will finally be able to be reimbursed to the county under the childcare fund. At least that is our plan with this application for the budget. We've been working with DHHS to review what in their programs need to, be modified to fit, and we think we have done that, and those programs, those positions, you will receive 75% reimbursement on. So that's something brand new for the county. Additionally, there are positions within juvenile casework that have only been partially refunded or reimbursed to the county. Those positions will now also qualify for up to 75% reimbursement on their full position. I anticipate it'll probably be I think there's about a dozen positions there that were partially funded that will have an opportunity to receive additional funding. In addition, over at Children's Village, and I think we have Lori Strong from there here and Heather Calcaterra, they will be working on the reentry program and receiving 75% reimbursement for their workers on reentry. Reentry has always only been handled over at the court, but under this new plan, because the first two phases of reentry really happen at the village, their workers will be receiving reimbursement when they weren't eligible before. So there's a lot of good things. One thing that is happening is we will lose approximately 1.9 million in funding that we've been receiving from the Raise the Age grant. The Raise the Age grant and in childcare fund, actually both. We're paying 100% of the expenses for children 17 and over at the time of their offense. those children will now just be considered part of the regular population for reimbursement. So they'll be reimbursed at 50 or 75. I estimate that to impact our budget about 1.9 million. But even after that, with the addition of the funding for these new positions, or not new positions, but new reimbursement for old positions, we anticipate that we will still be receiving approximately $3 million extra as a county under the child care fund. So that is a really good thing for the county as a whole. I do have within this budget, you'll see there are placeholders for a few positions that one is a quality assurance individual. We are required now by the new statute to have a quality assurance person who evaluates the effectiveness of our programs for juvenile justice, that looks at the statistics, recidivism, and also helps design new programs. We used to have actually a similar position many years ago, if you may remember the last held, I think, by Pam Davis as the manager of court services that kind of did that work. That position was eliminated with budget cuts years ago, but that position is now mandated, that quality assurance person. We initially planned a contract for a person, but simultaneously we're gonna work with HR to cost out what that position would be under our new salary schedule, what we would have to do to attract and retain. And we'll compare the two. And we may contract, we may actually have it as a position that we come back to you for and ask for actual funding. It will be, though, reimbursed at 75% by the child care fund. So no matter what we do, the position is mandated and reimbursable under child care fund, so it's included in here. There are 4 other positions, placeholders within the DHHS budget for positions that we think we may need next year. They do not obligate you to the position. We would plan on coming back should we need them and asking for, working through fiscal, working through HR to request a position. But they are in there for placeholders because DHHS wants to plan their budget as well, and they want us to tell us every possible need. I think that is all of the information I have. It's a lot. I'm running out of the ability to talk here. Does anybody have questions about this year's child care fund?
But I think the data is so important now for the grant requirements or any funding that you definitely need a QI person to manage that. It's a full-time job.
It actually isn't designing the programs, because really the whole idea with juvenile justice is to stop putting kids in a lockup, right, and try and develop programs that keep them within the community, within their environment, within their family structure, wherever possible, to help those kids. And that's what we want to do. We do expect, that's why the placeholder for those 3 YA positions, I have YA workers right now that have 100 kids on their caseload. 100 kids, we expect the quality assurance person to say, you can't, the first thing about quality is you can't have 100 kids on your caseload. So that's why we're putting those placeholders out there, but we are trying to plan ahead.
Thank you. And I'm excited to see how youth assistants will evolve with additional
proper funding?
monies and services. Yes, thank you. I know I've been the chair of my local youth assistants for many, many years, and I see the benefit and what we could do, and we could do more if we had more.
Right. I think they spend a lot of their time having to go around and raise money to support the programs that they try to offer. And if we can actually have proper funding for that.
Under the child care fund, they're cheaper to have.
Yes, they are. If we catch kids at diversion at that first step, it's a lot less expensive than incarceration, you know, at $900 a day.
Right. Thank you. Commissioner Gershenson?
I was gonna ask you to introduce yourself.
Oh, I'm so
yes.
sorry.
Pamela Monville, Deputy Court Administrator.
And I was gonna ask you how much is that placeholder amount?
Oh, for those items,
Approximately.
let me tell you, I know it was $125,000 I put in for the quality assurance person, because I know that probably will not cover all of their salary, but it will be somewhere around there, and it would not be a full year even if, because they won't be in place by October 1st, even if we decide to hire them. So it's $125 for them, and it is, let's see.
So approximately the 3 other positions then.
Looking right now, I apologize, I don't know that offhand. It is
You can get me that information
can, I
too,
could
cause
email
I
it to
would
you.
want it
It
for the
is-
budget hearing.
It is roughly, thank you, Marianne. I know it was 125 for the one. Oh, there they are, 80,938 for the YA workers. And then I think the other was about 100,000 for another accountant, bookkeeper, business analyst, whatever you wanna call it. Because I do think that we are missing opportunities in reporting items and expenditures to DHHS that would qualify for child care fund reimbursement. And I'd like to make sure that we have one person at the court who actually is responsible for gathering those. So with all of these new additional positions, that's gonna be a lot of extra work.
Thank you.
Yes. Commissioner Genzel?
Yes, thank you. So first of all, I believe in what you're doing. I think it's a lot of good work and happy to hear that we might be getting incremental reimbursements or new positions to be considered for reimbursement. So I guess I would just say that as we go through that process and we look at the incremental dollars we'll be getting from the state, you might have mentioned 3 million. I mean, clearly, whatever the number is, clearly you have the opportunity to reclaim it or repurpose it. And so I'm assuming we're gonna look at repurposing, but I would also encourage you that if it's repurposing with positions, that we would follow the path that we traditionally followed, which says, under the Gosling Amendment, if it's a position funded by a grant, when the grant goes away, the position goes away, so that we don't get in a position where we hire people, the grant money goes away and we still have the expense. So for our newer finance people, just to make sure
Thank you so much, I
we're.
really appreciate you saying that publicly.
I just wanted to add on to that we are already in a situation where that additional 25% reimbursement is already being spent. So earlier this year, around January, there were 5 new positions that were created as part of the child care fund that are being paid out of that additional 75%, or I'm sorry, that additional 25% reimbursement on in-home care expenses. So we're already starting to draw that down.
But those positions are 75% reimbursed, so the extra 25% of the whole that we're getting only has to cover the extra 25% of those positions.
Yeah, I mean, Madam Chair. So I guess I'll let the department head and the finance team work through the details. Just as I look for it to come back to the board, my, I guess, request or desire is that we attach it to the grant under the same policy so that we don't get upside down in any form or fashion should the grant money go away, that's all.
And I absolutely agree with what you're saying with the grants. This one, and we can figure out how we make that fit to child care fund, because it's not really a grant. So we wanna make sure that we can address that in some way. My concern was that really if we start getting 75% back for all of these youth assistance workers, that should, for some reason, they changed the funding model, right? Those were originally budgeted in our general fund. I would hope that you won't wanna cut all of my youth assistance workers because we've stopped getting their funding. That would be my only concern there.
Thank you.
Yeah.
Commissioner Genzel?
I guess that's my point, right? You have these people that we're paying for today out of the general fund, you're gonna get a subsidy or another revenue fund to fund them, which means our general fund now has incremental dollars over here that we could either reclaim or repurpose. And we could repurpose in your area, or we could repurpose in some other area, or we could just reclaim it and make our rainy day fund something else. But that's just the discussion I think we should have as you come back with your thoughts on what you would do to repurpose the money in your department, is what I'm assuming you would do.
We would hope that the legislation speaks to the extra 25% and some things that have to be funded out of it. Some of the things that have to be funded out of it are like that quality assurance person is supposed to be funded out. So there's a few things. It doesn't necessarily identify everything that the extra money is to be used for. If we reinvest it in services to youth and families that are 75% reimbursable, we're able to stretch it farther. But absolutely, we don't expect that those positions are being created today, and we don't expect that should the funding model change from DHHS, that it might not impact those new positions specifically. Hopefully it wouldn't impact the existing positions.
Yeah, great, thank you.
Commissioner Powell?
I forgot what I was about to say. Oh, no, I do not know. I was gonna say, with the youth assistance, I hope that, we can continue that success in that area because they kinda help with middlemen in our parents and getting them in line with their kid. Like, it does help to have that middle source to take that chasing or reviewing teachers or staff may have to deal with when we turn the situation over to youth assistance. So I think it's a great program, and I just hope we continue to keep that going. That's all I want to say.
I agree. A few years ago, the youth assistance budget was cut and we lost caseworkers. So now caseworkers have to share cities together, which limits their time in being able to provide services. So having the caseworkers on site to work in preventive care really makes a difference.
Yep.
Thank you. Anything else? Well, would you prompt the vote, please?
Now work on the last.
There we go.
Yeah, no.
Herb, Gidgel, Goshenson,
Thank you.
Oh, but it
Yes.
flipped.
He's the
7 yeas, 0 nays.
All right, thank you. Motion carries.
Thank you very much.
We have arrived at our last public comment of the day. Is there anyone from the public wishing to comment? All right, public comment is closed. Is there any other business to come before this committee, Commissioner Gershenson?
Thank you. I wanted to mention to fiscal, we have a Safer Communities Fund, and it's relatively new. And it's my understanding that contracts with schools and other organizations that have a resource officer, there is a portion given into this fund. So when we can get the information on how much is in there so that we can start to utilize that funding, it would be greatly appreciated. And if there's anything we have to do to facilitate that so we can get on a regular reporting system, that would be great.
So noted, thank you.
Commissioner Powell?
I was gonna say, we have a student, I think, here. And we always wanna know about our students here. So can you introduce yourself?
Yes, I'm Elena Merhassani. I'm a junior from International Academy West, and I'm just doing a project for school, so I was here to collect some information.
Thank you. Thank you, welcome, welcome.
It's like an online government course. I just need to get some firsthand experience with government.
Great,
Thank you.
Welcome.
Any other guests? I want, everybody young here. I ain't wanna- Oh, are you a student too? Oh, you can come on now. You didn't let me.
This is Priya Ramaswamy. She is an intern with SAVI, which is a South Asian foundation. She's interning with me both in terms of shadowing me as a commissioner to see how we work here, and also helping me with my campaign.
Nice to meet you. I would just want to say something to you both. My parents are deaf, so I'm fluent in sign language, and I had to depend a lot on mentors, internships, individuals, and it's always good for you to explore exactly what you want to do. And as adults, we always want to try to allow students to shadow and all of that, so always take that opportunity. But I just wanted to share that, stay in the internships, it helps guide what you want to do with your life moving forward, and good luck for you both, okay? Thank you.
All right, any other business? All right, Public Health and Safety Committee meeting is adjourned at 11:29. Thank you, everybody.
All right.
Might make